Hi everyone, we're ready to get started because it is 4:20. I do welcome jokes during the discussion period. It was on my list of things to do today was to try to come up with a few really good cannabis jokes to MC this presentation with, and I didn't get to it. It is still on my to-do list, so you guys are going to have to pick up my slack. I'm Karen Urbanowski. I'm a scientist with the Canadian Institute of Substance Use Research and an assistant professor in the School of Public Health and Social Policy here at the University of Victoria. And I am going to MC our panel, our very illustrious panel of speakers who are going to share some of the findings from the research that we've done at our institute and the work that's been done by others, and just try to share a bit of information around what we know and don't know about cannabis pending legalization at midnight. To get us started, I would like to acknowledge with respect the Lekwungen-speaking peoples on whose traditional territory the university stands, and the Songhees, the Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. I feel privileged and honored to be here on this land, and we thank them for that. So just a little bit about our research institute. We used to be called CAR-BC, the Center for Addiction Research in British Columbia. So that's how some of you might know us. We're a network of individual scientists and teams that are dedicated to the study of substance use as well as addiction in support of community-wide efforts to promote health, to reduce harm. We have a variety of projects, and I encourage you to seek out our website if you're interested in learning about what more we do at the center. Come visit us sometime. We're up in the Technology Enterprise facility. It's a lovely building. Today, we're going to have 5 guest speakers, so I'll introduce them and give you a brief overview of what they're going to speak about. Each of our presenters will speak for between 5 and 10 minutes. They will receive a 1-minute warning at 9 minutes. And then at 10 minutes, I will forcibly remove you from the microphone. I do ask that you hold your questions until the end. We figure we'll let all 5 go, and then we can have a bit of a moderated discussion. How does that sound? Okay, fantastic. So first up, we have Adam Sherk. Adam is a doctoral candidate in the Social Dimensions of Health program here at UVic, and he is a research associate at CISUR and a Canada Graduate Scholar. His research is focused largely on substance use and health, and he's going to talk to us today about cannabis use in Canada, giving us an overview of current cannabis use in Canada as well as in BC. He's going to discuss some harms and some costs associated with cannabis from a recent national costing study that we were involved in.
Thank you. Okay, clearly I'm not illustrious at all, so I'm just here to set the stage for the panelists that will come. We'll just kind of set the stage. So we'll talk about how many people are using cannabis in Canada. And then like Karen said, we'll get into some potential harms and the cost to society of people using cannabis, what this might mean for us in Canada as we do this really monumental shift in substance use policy that's only been done in one other country in the world, which is Uruguay. It's kind of hard to see. Okay, I can see down here. Yeah, so I was going to say cannabis is the most widely used illicit drug in the world and also in Canada. So I put it in quotes because, of course, tomorrow those quotes will state it'll be legal, right? So this is something to keep in mind. In Canada, depending on the source of information you look at, between 10 and 20% of all adults have used cannabis, and then in some measure of time, say in the last year. If we look at StatsCan is running this special survey right now called the National Cannabis Survey, and they're putting out quarterly results. If we look at their quarterly results from July to September, which just came out a few days ago for this year, we see that actually about 20% of adults, here meaning people 15 or older, in BC have used cannabis in the last 3 months. And in Canada, it's about 15%. So to put that into number of humans, in BC, that's 800,000 people have used cannabis in the last 3 months. In Canada, 4.6 million. So those numbers are right from StatsCan. I was surprised at how high that was. Was anybody else surprised at how high it was? The number of people? And a few people thought it was maybe too low. Does anybody think it's too low? I think it depends on your, And then there's there's quite a breakdown by age group. So 15 to 24-year-olds are about twice as likely to use cannabis as those older than that. Now I want to talk about a recent national project that our center, Canadian Institute for Substance Use Research, did in collaboration with the Canadian Centre on Substance Use and Addiction, hence the slides with two kind of title institutions at the top. A multi-year national study. That project has its own dedicated website, which is CISUR.ca if anyone's interested to see some laptops. You could look at it now or later. We looked at, we categorized psychoactive drugs into 8 different categories: alcohol, tobacco, opioids, cannabis, and so on. And we looked at 4 cost categories. I know that's pretty small, but it's healthcare costs, economic loss of production costs when people are removed from the workforce, criminal justice cost, and other costs. So the cost of substance use in Canada, this is all substances combined, not just cannabis. We found that those psychoactive drugs cost Canadian society about $38 billion per year. That's an amount that's about equivalent to some of the maritime provinces' entire gross domestic product for a year. So like everyone working all year in Nova Scotia to produce what they produce, that's about the amount that it costs Canadian society of us using alcohol, cannabis, and other drugs. Now I want to focus in on that red circled graph. And here we can look at the 4 different categories of cost contributors to those 8 different substance types. And we want to focus in on cannabis today. So we can see from the graph that alcohol leads the way. It's the most harmful substance in society because so many people are users of alcohol. Almost 80% of all Canadians use alcohol in a given year. Cannabis is in 4th, but not many people use it right now, and this may go up over time. We'll see. So starting from the bottom and filling up that little pictogram from the bottom to top, we see that healthcare-related costs of people using cannabis was about $200 million. Lost productivity, people being removed from the workforce due to death or disability, was $350 million. And then a very large portion came from criminal justice costs, $1.7, $1.8 billion. And we can speculate what might happen now that cannabis is going to be legal instead of enforcement costs around it being illegal. Focusing in on the health harms, so our study found for 2014, which was the most recent year, that cannabis is estimated to cause about 850 deaths and about 3,800 hospital stays per year. Something that is a contributor to those number of deaths is motor vehicle collisions. So driving under the influence of cannabis or DUIC is, and different studies have different estimates here, but right here I have a 92% increase. So you'd be about 1.9 times more likely to be involved in a collision if you're driving under the influence of cannabis as if you were not. And these results are very consistent. So it's kind of colloquially debated, but in the scientific literature, there's a very strong link that if you're driving under the influence of cannabis, your risk of getting into a collision is much higher than otherwise it would be. And then Russ is going to talk about this next, so I won't go into it very much, but there are a host of other conditions which we suspect or maybe posit that may be involved with cannabis use, but the research might not be quite there, and this is because it's been illegal. It's hard to study. So we'll have lots of new research directions when cannabis is legalized. Criminal justice costs, about that $1.8 billion in Canada per year, with policing, with courts, with corrections. And a lot of these are with the Federal Controlled Drugs and Substances Act. And tomorrow, of course, those will be removed. It won't be illegal anymore to possess certain amounts of cannabis or to sell it in authorized stores. So you could maybe posit that those costs will come down. You would expect that to happen tomorrow when cannabis is legalized. And then when I was preparing for this presentation, I just came across a few resources that I thought you'd be interested in. Amanda gave me the first one, which is heretohelp.bc.ca. That looks as kind of a focus on mental health and substance use of different types. They have a lot of information on cannabis. The federal government, some of you might have got that placard, which is mailed out by the governments of Canada or BC in the mail. And I just saw this website. I thought it was interesting. They talk about the health harms. They talk about some other things on there. And then some good information from New Brunswick, Cannabis 101. This third one, believe it or not, will give you a step-by-step instruction guide on how to roll a joint. So governments are doing different things across the country to prepare for legalization tomorrow. And then as a thought experiment going forward tomorrow and beyond, first of all, Canada is kind of like a staging ground for this incredible experiment in cannabis legalization. Again, Uruguay is the only country that's federally legalized cannabis globally. So a lot of like very developed countries, Uruguay is not quite as developed as Canada. They're going to be looking to Canada to see what happens. And the provinces and territories do it their own way. So there's these different experiments. What might happen, we expect to see from things that happen in the US, for example, Washington State, that the prevalence of cannabis use will probably go up once cannabis is legalized. Will this have effects on people's use of other psychoactive drugs, in particular alcohol? So Tim will talk about that in his talk. Then we think about health harms. Might these increase when people are using more cannabis? Maybe they're using it, more people are using it and using it more often. What might this do to collisions and so forth over society? And those criminal justice costs. So we're removing cannabis from the Controlled Drugs and Substances Act federally. That's going to reduce those costs, likely, I'm positing, but we can all think about that, how that will happen after legalization tomorrow.